So what I wanted to do today is I kind of wanted to go back to this conversation that we were having a couple weeks ago regarding orthodontic treatment and versus cosmetic dentistry. And one of the things I wanted to talk about was this question that always comes up in orthodontic treatment. And it's when someone has a lot of crowding, and that's where they don't have enough space for all their teeth. The question that always arises is whether the question, should we have teeth pulled, adult teeth pulled, to make room for the teeth? And so one of the things that we're really passionate about in the office here is we tell people this all the time, that we'd like to do non-extraction orthodontic treatment. And in doing non-extraction orthodontic treatment, that means simply we try to minimize or reduce the probability or the likelihood that we need to pull teeth out in order to make space for all the teeth. And one of the reasons that we're really adamant about this is because we know that orthodontic treatment, one of the things that it allows for that's a little different than just doing cosmetic dentistry or veneers, is we know that we can influence the facial features of our patients when we do orthodontic treatment. And one of the things that I want to be clear about is this question about extraction therapy or non-extraction therapy. And so what I wanted to do today was talk about a particular scenario. And so these are two twin sisters, and I've talked about this before in the past, and I might even show this example in a previous Friday Focus, but I kind of want to bring this up. Is here are two twin sisters. The only difference that's going to happen in their orthodontic treatment is one's going to have teeth taken out to make space for all the teeth, and one is not. And so this is what they look like before they start treatment. And so one of the things that we want to look at is just look at the nice facial balance between the two sisters. The way the nose, the upper lip, and everything kind of fits together for both of them. And so next thing that we want to do is look at their facial profiles, how they look like from the side. And see, I had this conversation yesterday with a dad. I know that when you bring a patient in, whether it be, and especially when you bring your kids in, the thing that we want to do is we want to make sure that we do everything in our powers, not only to give your children straight teeth, but we want to make sure that we are doing what's right. And I know that, like I was speaking to a dad yesterday, I was like, you're entrusting me to make your daughter look better than she did before walking into my office. And he goes, yep, it's absolutely correct. And I said, yep. And so I said to him, I was like, look, his daughter had a lot of crowding. She was 8 years old, and I said, okay, I said the same message to him. I said, okay, we got to create space so that in the future I don't need to have teeth taken out. And then I showed him the consequences. Now let's go to let's talk about this. So this is after the girls have had their braces, and you now have to distinguish or determine which of the two had teeth pulled. And so when you look here, when you look at someone from the front, it doesn't necessarily make a big impact. Now, when you look at them from the sides, this is where it all changes. And you can see, so like one of our goals, right, and I'm just going to talk about is, one of our goals is if I draw a dot between the nose and the chin, I put putting this toothpaste holder here a little bit. But what I want is, I want the upper lip and lower lip to be as close to the edge of this box. And so if you go and look here, you can see that what happened when the 4 teeth were pulled out on her upper lip got pushed inward and her lower lip, and so it moves away. And so, like I said to the dad yesterday, she's going to end up aging faster, because we know that as she gets older, her nose and her chin get bigger, because that's just aging. So we believe that keeping the upper lip and lower lip as close to that line as possible is the ultimate goal. And so what we want to do is just minimize the opportunity or minimize the probability that you need to have teeth taken out. And the reason is like the thing that I always say about this, the number of teeth that you have as an adult and the position of those teeth make a difference in the facial outcome of the people that we serve. And so because of that, we're really adamant about making sure that we put ourselves or secure or increase the likelihood that your children, at least in our office, won't need to have adult teeth pulled. And now I'll get a swarm of doctors who will tell me that extraction therapy works, and I totally, I've done extraction therapy, and I said it's not that there's nothing wrong with it. It just produces a different type of aesthetics. And because it produces a different facial result, I'm just one who believes that I like this more than I like that. And so that's one of the things that you have to start to look at when you're distinguishing between the treatment modalities or treatment approaches that you're being presented. And so I just wanted to bring that to the forefront. So the message here is that should you extract, there's cases where you definitely need to, absolutely. But in our office, we're going to try to mitigate that need. We're going to do everything in our power. Sometimes we do orthodontic treatment in 2 stages, a part 1 and a part 2, to avoid the need or reduce the risk of needing. And so that's one of you just got to understand that that's our approach. So should you extract teeth? The answer is case by case basis. I mean, if your kid came around the corner and the first thing that you saw was his teeth protruding out, and then maybe I could have an argument that taking teeth out is warranted. But in just the normal everyday question of if you have crowding, should you pull teeth to create space, I would probably tend to try to mitigate from happening. Okay? Again, the most important thing is our facial outcome. Having straight teeth is important. Having straight teeth plus a healthy bite plus looking good is what we're out to achieve here at E&S Orthodontics. And so going back to our orthodontic treatment where we do orthodontics and restorative, this is an impact where orthodontically we can make a great difference for people who have profiles that are a little bit flat, and we want to make them a little fuller, and so that's what we're up to. We are here in the middle of August, and we are thinking about the Fall Festival in this blazing sun. And I don't know about you, but I am looking for forward to having the summer finally be over. And what better way to do that than ring in the fall with our Fall Festival. And so the Fall Festival this year is going to be October 14th. It's going to be the evening of the 14th. And we are going to be having it at our Peoria office like we do every year. And this is going to be our 6th annual Fall Festival. We have a Disney theme for you this year, and so we're really excited that you come in your favorite Disney character and have a lot of fun for us. We're going to have food, games, prizes, and I hope this year it will not rain like it did last year, but last year was just an amazing turnout. We had over 800 people show up even though it rained for the majority of the day, and we weren't able to have the games last year. But last year 6 people came away with free braces, and this year we're going to be giving away free braces again as a prize. And so normally we never talk about it, it's kind of understood, but this year we're going to just let you know we're going to be giving free braces away. And so one of the ways that you're going to be able to win a set of braces for you, your family, or a friend of yours, or whoever you want to give that to, is by registering early for the Fall Festival. And so we have already had 160 people register for the fall event. And so, there is a capacity limit. We're not going to be able to have everyone come, but please register early.
and get yourself put into the drawing. And then again, we're also teaming up with the Salvation Army this year. We're doing our clothes drive, and what we're going to do is, so look forward into the email that we'll send to you about the rules about how we're going to do the clothes drive this year, and how you can win tickets or have the opportunity to also win free braces related around that. So that's really something that we're looking forward to. Again, it's going to be October 14th this year. It's a Friday. It's going to be Friday evening at the Peoria office. Everyone is welcome to bring their friends, family, from Tullison, from our Phoenix Tullison office to Chandler. And you know, I really encourage people from Chandler. I know you don't, it seems like a far drive, but we end up having so much fun at the event. I'm going to be answering the question of what you should do when your bracket falls off during orthodontic treatment. Obviously, we don't want your bracket to fall off during treatment because it actually slows down treatment. But we wanted to give you the scenario. It's inevitably going to happen, and so what we wanted to do is kind of give you a little bit of a background on what you should try to do in the case that it does. And so the first thing that you want to do is you want to contact the orthodontic office and let them know that one of your brackets has fallen off. And then the assistant or the person scheduling the appointments can determine whether the bracket needs to be put on immediately within a couple days of it falling off, or it can wait till your next orthodontic appointment depending on when you're scheduled out. The second thing that can happen is if you do have a bracket that falls off, depending on where in the mouth it falls off, it can have different consequences. So a lot of times if your bracket falls off near the back of your mouth, that could lead to a pokey wire, and if you have a pokey wire, then that could actually cause some pain, and so that would be something that you would want to kind of immediately address. Sometimes a bracket will fall off in the front or in the on the sides, and so sometimes those brackets can actually be delayed in terms of putting them back on, but it really depends on where you are in treatment. And so that's really one of the most critical things that I want you to kind of get away from this video is you want to know, like if you're in the beginning part of your orthodontic treatment, it's probably like having a bracket come off is as concern, like big as a concern to me as if you had a bracket come off near the end of treatment. And the reason is near the end of treatment, we're usually trying to dial in your bite and the final positions of the teeth. So having a bracket come off near the end of treatment is more critical, because if a bracket comes off and we don't get that repaired within 24 to 48 hours, then we can have a tooth shift in a way that would actually preclude you from actually getting, you know, possibly your braces off if you were scheduled to have them off. And so it really depends on the timing of when that bracket does come off. The thing that I want to kind of also address is like why you actually have a bracket come off. And there's, you know, really two fundamental ways that brackets will come off. One is you could be eating something that's inappropriate. So a lot of times, you know, if you're taking the risk of chewing on candy or a lollipop or a popcorn, anything that's really hard that could actually shear off the bracket, that'll actually dislodge the bracket and make it loose. The second way is that when we are actually bonding or we're actually replacing the bracket on your tooth, sometimes we can have a moisture contamination, and so that's a big issue. Sometimes there's isolation issues with you in terms of trying to get the tooth completely dry so that we can put the bracket on. So those are multiple reasons a bracket actually could come off. Now, in terms of in our office, what we would like you to do is we'd really like you to call our office, speak to one of our scheduling coordinators, and then they'll schedule you a time to come back in. A lot of times they'll be able to address whether it's a true emergency, whether you need to come in or not at that immediate time, you know, that day or the next day. In terms of if it happens after hours, there's always an after hours phone number that you can reach out, and then one of our assistants can kind of walk you through different things that you can do. And so some of the things that you can do if it's after hours is you can actually, if the tooth is moving, the bracket's moving in the front, you can actually put wax on and hold the bracket in place. If the wire's poking you, you can put wax on the edge of the wires. If the wax isn't sticking, sometimes you can use sugarless gum for a short period of time and put that, and that'll actually protect the area. And then sometimes, depending on when you're in treatment, you can actually have someone snip the wire. But sometimes you got to be really careful when you do that because it actually cause other problems. And so our best piece of advice is come into the office, give us a call, we'll work you into our schedule, and we'll go ahead and take care of that emergency. How long does the average treatment time take in our office? And so that kind of varies from person to person depending on each person's own specific problem. But the average amount of time that our patients are in treatment is about 14 to 18 months. And that's for relatively quick, simple cases. And then typically those treatment times can extend out to about 24 months. But we've, over the last year, we've introduced different ways to reduce the treatment time, and I've talked to you about those ways. One of those ways is using Propel orthodontics. The other one is using Accelident. And so we're always, and then the third way was using custom braces to reduce treatment time. So if time is a big concern for you, that is one of the things that we've been addressing over the last year, is how to make treatment time more quicker and more effective. And so if you compare our treatment time compared to, say, using traditional braces, so if you remember, or if you've seen a couple of our Friday focuses, we employ the Damon system in our office. And so what that allows us to do is, in essence, reduce the amount of time people are in treatment, but more importantly, it also allows us to treat in a more comfortable way. And what that means is we're able to use light forces over a longer period of time to get the desired movement that we want. And I know that if you know me, and if you've been in the office over the last year and a half, you know that I've been talking about getting braces put on. And so last week, I actually got my braces put on for the first time. And it's not my first time in treatment, it's actually my fourth time in treatment. And it was really funny. I want to just share an anecdote with my wife called me up and didn't know I was getting braces put on, and I got the braces put on, and she's like, "Oh my God, you're going to be able to experience what other people experience." And being this my fourth time in braces, it's my first time in Damon treatment, and I said to her, I think I'm going to have lack of empathy with my patients. And she goes, "Why?" I go, compared to traditional braces, the amount of discomfort or what I've experienced so far is far less than what I experienced in my 3 previous treatments. And so I hope that doesn't, for all the people who say, "Oh my God, this is the worst thing ever," I'm enduring it with you. I'm going through the experience with you. And so keep abreast. I'll keep talking about my orthodontic treatment as I go through some of the Friday focuses. But for the first week, it hasn't been bad at all. The biggest thing that I've had is my son, on the first day that I had braces, I had put him in timeout, and he didn't want to be in timeout, and he lifted his head and he smacked me right in the middle of the face. And so that was the most traumatic thing that I experienced during my first week. So listen, have a great Labor Day weekend. Again, if you're interested in knowing more, like how long you would actually be in treatment, again, we have ways in the office to reduce it, so we can get your treatment down to 6 to 8 months, depending on what systems we employ. But the average amount of time we're in braces usually is about 14 to 18 months. Some treatment can take up to 24 months, depending on the severity. But we can give you a sort of a guide of how long it would take you personally, because every person's different. And then, like I said, Damon treatment usually takes about 6 months to 8 months less than traditional orthodontics using traditional braces.